Thank you. It's good to be here this morning with all of my colleagues to talk about health care reform. And there's a lot of disagreement about what the right answer is. What I'd like to spend my time on this morning is why the status quo is not an answer here. And I think that if we can get agreement on that, we can solve the issues that confront the working families in my state and all across the country. You know, Mr. President, median family income in Colorado has actually declined by $800 over the last 10 years. At the same time, the cost of health insurance has gone up by 97%. It's more than it's doubled over that period of time, and that's happened all over the country. This slide shows the difference between the rate of the increase of wages in my state from 2000 to 2007 versus the rate of the increase in insurance. And I've talked to small business people all over the state of Colorado who said they're trying to continue to insure their employees just as they have for generations in family-owned businesses, but they're finding that they're having to make a trade-off between people's wages because the cost of insurance is getting so large. And by 2016 in my state, working families in Colorado are going to be spending roughly 40% of their income on health care if we don't change the status quo. It's also having a profound effect on the finances of the federal government. The biggest drivers of our deficits, as the red line shows, are rising Medicare and Medicaid costs. If we can change that, we can begin to restore our government to fiscal health. If we don't change it, we're going to continue to pile mountains of debt onto our kids and our grandkids, something nobody in this chamber, and I can assure you no one in my state, wants us to do. Let me see the last slide here. Finally, the last slide shows that we are consuming almost 20% of our gross domestic product on health care, devoting almost a fifth of our economy to health care, when all our competitors across the globe are devoting less than half that to health care. And it's no different than if you had two small businesses across the street from each other, one spending a fifth of their revenue on their light bill, the other is spending less than half of that on their light bill. You don't need an MBA to know which of those two companies is going to be able to invest and grow their business. The senator from New Hampshire talked about a very important cost control measure in this bill that has to do with transitions of care. Right now in this country, 1 out of 5 Medicare patients is readmitted to the hospital within the first month that they leave. And that's because nobody's following up to make sure they're getting the care they need to stay well. Nobody's checking to see whether they filled their prescription or whether they're taking it. In Colorado, we have great models. Mesa County and Grand Junction, where the hospital readmission rate is not 20%, but 2%. This alone is costing us $17 billion a year. If we can do it smarter, if we can do it more cheaply, and if we can provide the kind of quality we see in Grand Junction, the Mayo Clinic, and other places across the country, we should. That's what this reform is about. It's time for us to put the politics aside and come to an agreement that's going to create a much improved situation for our working families and small businesses than the ones they confront. The status quo is eating people alive all across this country. We ought to be able to do better than that. Thank you, Madam President.